This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I am not board certified in anything or medically inclined, but I'm really excited, Alice, because we have a return guest.
I know, our favorite internal medicine specialist.
Buckeye.
And Buckeye.
And
Yes.
Buckeye.
Dr. Liesl Bigge.
And I got my Buckeye.
Oh, yes, and the Buckeye necklace.
And
yes. One more thing, the hat.
Oh my God.
Gotcha.
And Dr. Bigge is in her Buckeye room. And if I'm not mistaken,
In her
Dr.
Buckeye
Bigge,
chair.
My Buckeye
you are
chair.
just back from the yearly internal medicine meeting in D.C. this year, was it?
It's Louisville.
Oh, Louisville. Oh,
Louisville.
closer. That's good.
Mm-hmm.
Yeah. So today we thought we would talk about endocrine disease in our pets. What's that? Things like diabetes, things like Cushing's disease, and if we have time, thyroid disease. So I think we'll start with diabetes. Janet, what would you like to ask Dr. Bigge?
Well, how do you know if your pet, I had a diabetic cat, how do you know if your pet has diabetes? What are the warning signs? What is treatment like? I know what that's like for a feline.
Right. And what's new? Like, what
Oh, wow.
new stuff about diabetes did you find out at the meeting? So we'll
there's
start with you, though.
Okay, so clinical signs of diabetes are pretty much the same between dogs and cats. It tends to be noticing that they're drinking more water and subsequently urinating more.
Yeah.
They'll be eating well, usually they'll be eating well, but losing weight. And I mean, that's probably the things that pet owners sort of see most often, you know. So what we call in veterinary medicine PU, PD, PP, polyuria, polydipsia, polyphagia. So we have the polys, as we say. That's probably the most common thing that we're going to see. Now you can see pets where the owners aren't going to necessarily see those signs as predominantly, and then the pet just ends up being sick. You know, like vomiting. Most of the time it would be vomiting and off food and not eating. And then sometimes you'll get a history that, oh yeah, he's been drinking a lot for a few months, and they just kind of didn't pay attention to the fact that the pet was probably losing weight and that. And those guys are, you know, sick on presentation. But most of the time they're coming in and just with a complaint. Most of the time it's the drinking more and urinating more that we see, both dogs and cats.
What about ages? Is it old pet?
Oh, ages. It's an old pet disease. Yeah.
Okay.
Sorry about that.
No,
we
that's all right.
see a few every once in a while, a juvenile onset, you know, or youngster onset, but that's super uncommon. Like in your career, you might catch a couple, but the vast majority of them are older pets. They tend to be in cats, especially, tends to be obese pets, but you can have them in thin pets. Dogs, they can go either way. You know, they don't necessarily have to be obese. In dogs, they may have had a history of having pancreatitis at some point in time. The pancreas being this organ in the body that creates not only digestive enzymes, but it also creates insulin, you know, and releases insulin. So it has kind of two giant functions. And in a dog who's had pancreatitis, which is inflammation of the pancreas, and it's more of the digestive enzyme part of the pancreas that gets inflamed, but the whole pancreas gets inflamed, and that can set up a situation where then the endocrine part of the pancreas, or the part that makes insulin, is not able to make insulin. So dogs and cats, the etiologies are a little bit different. The overall reason for diabetes, as just like in people, there's just lack of insulin or the lack of function of insulin in the body. So
Well, and it can lead to blindness because my in-laws' dog,
Sure.
their Westie, went blind before they figured
yeah,
out that
yeah,
the dog
yeah.
had-
In people that have diabetes for long periods of time, it leads to retinal changes, but also in people they can get cataracts, less commonly cataracts in people from diabetes, but in dogs. Most often dogs, we don't see too many cataracts in cats from diabetes, but that's because
they're called cataracts.
yeah, so
Couldn't resist.
we can It's like the CAT scans, etc.
Yeah.
But anyways, we can get rapid onset cats. That would be a really weird presentation if a pet was presented for cataracts and the owner like was clueless as to the other things that were happening. But I suppose it could if you had somebody who was very not paying attention to what's going on, at least with the drinking and urinating part of
So
things.
what are
But
treatments like for a diabetic cat or a diabetic?
ooh, this is where it gets really fun.
Yeah, been there.
It really does, because there's some new stuff that we've known about for a little while, but there's more stuff that just not super new stuff that came out at the meeting. But for the most part, our patients tend to be more insulin dependent, as opposed to people who can live their life not ever needing insulin. Most of the time, our pets are going to need insulin. Dogs almost always are insulin dependent. In fact, I never refer to dogs as not needing insulin. They just do.
Yeah.
Kitties, on the other hand, and this is where it gets kind of exciting, we do now have some oral anti-hyperglycemic agents or oral drugs to help lower blood glucose, and they're really, really cool. They're a once a day drug. There's a liquid form of it called Semvalgo. There's an pill form called Bexacat. And what the mechanism of action of these drugs is that they help the body, they block the body's ability to resorb glucose from the urine. So the urine, the kidneys are able to pull back glucose, on a regular basis. And so what these do is they block this SGLT2 receptor that allows then sugar, glucose to dump into the urine, and then it can bring down the blood sugar that way. It's really cool. It's easy. In fact, I think I have, there we go. Not to do a little advertisement, but there's Bexacat. Yeah, so this is a pill. They're pretty, I think obviously I'm not eating them, but they're, they smell
No, you're
like.
on Ozempic, right?
Yeah, right. No, I don't wish. I don't want the GI stuff with all that
Oh,
stuff.
I know, it's terrible.
It's so bad.
You know, with the human,
But
they have the thing and they have the app where they can check their glucose level. Do you have to do that with a pet?
okay, so do you want? So we can do that. We can't. So the CGMs, or continuous glucose monitors, have been validated for use in dogs and cats. The one that we recommend, or the one that's been validated, is the Freestyle Libre, and it's pretty slick. I think now they last about 15 days. Like the Freestyle Libre 3 Plus lasts about 15 days, and they're super useful when we have to use insulin. Okay, we don't really use it when we're using the oral agents, but the other thing, kind of getting back to this, because there's a lot with this, some super important things with using the oral agents, the Bexacat or Semvalgo, is the pets can't have any other illnesses. They can't have any other disease. They can't have, at least right now, I think in Europe, people are tending to bend the rules of what's listed in the the pamphlet, the inserts and stuff, and are using it sometimes with concomitant diseases. But you can't use it if they have GI disease. You can't use it if they have heart disease. You can't use it if they have kidney disease. Okay, so that's the one caveat. And again, only available for cats, not available for dogs.
Does it make those other diseases worse if you put them on Bexacat?
Well, what can happen? One of the side effects that we can see with these, which really have like pretty much no side effects from like causing vomiting, causing diarrhea, causing any bad stuff, and they even don't cause low blood sugar, and they don't do that because there's an extra little receptor in the kidney that's actually able to still bring back a little bit of sugar, a little bit of glucose, and that's what prevents hypoglycemia, or low blood sugar, from happening in these guys. But what we do have to look for are these things called ketones. Okay, and ketones are, if you've ever been on the Atkins diet, or the diets where you're basically just eating fat and protein, and don't have a lot of carbs, the body will switch to having to use those fats and proteins to make glucose, to make sugar. And what can happen with Bexacat and Semvalgo is that you can have a situation where the blood sugar is normal, but there's been a buildup of ketones in the body. Right. And so that's one thing that we do have to watch pretty closely, and your veterinarian will go over that with you, is checking ketones periodically and keeping them below a certain level. And it's blood ketones.
Oh, blood
So we
ketones,
can
not the
blood,
urine.
not urine. So you can check. I know this. I was going to bring that. So you can check urine ketones, just with the little dipstick things. But we also check blood ketones, and
Blood.
there's little ketone meters, just like a little blood glucose meter that you can prick your finger into. We can now do that for ketones, and if the ketones don't stay below a certain level, we have to discontinue this medication and switch to
Okay.
insulin. Okay, so it has its place. It has its place in the
Sure.
correct patients, and it can work really, really well. But there really is follow-up. It's not, you can't just, put them on it and forget it and say, oh yeah, if you start drinking a lot and urinating a lot, then come back in. It's not how it works, because they can get pretty sick with it. But it is cool. It is really cool that we now have this option, because before we didn't really have good oral options for cats. Dogs, sorry, we don't really have it. It is.
Someone's
It's
actually
super
doing the
exciting.
research to,
Oh, and there's tons.
to give an option besides insulin.
Well,
Yes.
and as a former injector,
I knew this
Yeah.
was coming. Twice a day.
Is it a problem?
but she loved it because you have to feed them, the cat.
Yeah.
So she
Well,
got
okay.
stinky
going.
cat food on the dryer. We'd put her on the dryer, and she would literally go like this. I'm ready.
Yeah, I'm ready.
Put it in.
That's so cute.
It was
So-
cute, but
so
the
there's-
two I have now, this would never work.
Yeah. So there's some, just kind of really cool stuff with cats, and this whole oh yeah, you got to eat them, and you got to feed them, and if they don't eat, you can't give them the insulin. We are really getting away from that. Especially, I know, especially in cats, because if we use the, particularly, okay, I don't know how crazy, I don't want to be too technical, but there's kind of two classes of insulins. There's insulins that are clear, they're solutions.
Yep.
Okay.
And then there's insulins that are suspension, where you have to shake them up and they're all cloudy. And I guess that's a super basic description of two types of giant class of insulins. One of them are considered basal insulins. The solution insulins, the clear insulins, are called basal insulins. That's what the vast majority of people are on. That's what they put in the insulin pumps. That's what, that pretty much everybody, a human, is on a basal insulin. In veterinary medicine, we have, for the most part, used mostly suspension insulins. And those are your NPH, and that's probably the one that people are most familiar with. But those are probably going to go by the wayside completely by 2026 on the human side. On the human side.
On the human side.
And so we're only going to be left with a couple different suspension insulins, and hence a lot of the research is going into using solution insulins or basal insulins in dogs and cats. And those insulins don't, because they're less potent, they can still cause glucose to go super low, but you don't get these ups and downs, these crazy ups and downs that you can get with the more potent, shorter acting suspension insulins. So all that being said, what it has to do with feeding is that when you're using a basal insulin, the solution insulins, you don't necessarily have to have the timing perfect. So if a dog or cat is on insulin, if they're on once a day insulin, you can usually vary those by 2 or 3 hours dosing wise, and they don't have to actually eat at the exact same time. And if they're on twice a day dosing, same concept. You can vary those doses. It's so cool. I know. It's like things that we were so dogmatic, like your life revolved around having to make sure you get home to, give the injections and feed, and it's going to make life a lot easier.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator based called NP, or a hydrolyzed salmon based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So just some other cool things is that
Yeah.
instead of having owners, we're also kind of migrating towards using more pens instead of
Oh,
using
good.
an insulin bottle
Oh,
and
wow.
you
Yes.
know, a syringe, and you got to stick them in there and pull it all up. We're going towards the auto injecting pens. So you know, you can YouTube how to use them, and I'm telling you, once a person goes from having to drop the insulin to then
Yeah.
being able to use a pen, they don't go back. They do
Yeah.
not
Why
want to go
would
back
you?
to using. I know, and much more accurate dosing.
Yeah.
Even amongst, like, if
Yeah.
Alice were to pull it up and you guys were going to each pull up, I want you to each pull up 1 unit of insulin.
Yeah.
And believe me, when they've done technical studies to evacuate, you know, read
Sure.
all of what everybody's pulled up, they're off by, you know, half a unit, you know, and sometimes even a full unit. So
Right.
that's a pretty cool thing too. But
And you know, we used to have problems. I'm sure, Liesl, as an internist, you had problems with sometimes the pharmacy would dispense the wrong syringes.
oh my gosh, right.
And
So
talk a little bit about
Oh.
that.
yeah,
That's
so
scary.
yeah, so we're in a good place with that now, because
Good.
currently there's pretty much only what's called U100 insulin for the
Okay.
most part. And what that means is that there's 100 units per 1 ml of the insulin that's in the bottle. Now, on our side of things, on the veterinary side of things, we do still have Vetsolin, which is a suspension insulin, and that does use U40 syringes. So that means there's 40 units in a syringe in a ml.
Right.
And those syringes you should be only getting from your veterinarian. You shouldn't
Okay.
even attempt to get them from a human pharmacy, because they're
Yeah.
something's gonna get messed up. And if
Yep.
they're
Yeah.
Vetsolin, you have to pay particular attention that you have the right syringe type. Pretty much everything else is U100. There's a U300 insulin that's pretty slick. That's that's called Tujeo. I'm sure you've seen the commercials
Oh,
on
right.
TV. So Tujeo, it is a solution insulin, but it's 300 units per ml. And it's really super helpful for very large dogs that are on large
Right.
volumes of insulin. And it works pretty slick for them. So, but you're right about
As long
those.
as they don't have commercials with those people
Oh my
dancing.
God, with those people dancing, could you just stop?
I know.
Could you just
It's
stop?
crazy.
I have a comment though. In Durham, you know, I would get some elderly cats in that weren't diabetic, and of course they were itchy, and their veterinarian gave them a long-acting cortisone shot, a depot shot, and it threw them into diabetes.
Correct. Yeah.
Now, was that a transient? Can they come? Did they
Yeah.
have? You know what I'm getting at?
Yeah, what we see, we can see that in cats in particular. So steroids block the action of insulin on the cell. So
Okay.
and steroids being prednisone, dexamethasone, and as Alice alluded
Depot.
to,
Yeah.
depot shots, where it's a long-acting shot. And most of the depot shots last, you know, at least 2 weeks. You know, probably a little bit longer than that.
Yeah.
Maybe a month. You know, it just depends on the cat. But what that can do is, if a cat is set up in a situation to be diabetic, like it's thinking about it, you know, their body's
Right. It's on the
maybe
cusp.
not making it's like a wannabe diabetic,
Yeah.
especially if it's obese, you know, because obesity is
Oh,
again
yeah.
fights against the action of insulin, and then we give it a steroid shot. Oh yeah, we can absolutely see that antagonism, that war between the steroid and the insulin. Now, it can be temporary. Once that once that steroid does wear off, we can see that them revert to having just enough insulin to do their thing. But it does set you up for, we better get some weight off this pet.
Yeah.
We better really keep a closer eye on it, and then cluing the pet owner into, hey, you better really watch for, you know, the pet, you know, drinking more, urinating more, you know, watch for the clinical signs of diabetes, and then so we don't miss it, you know,
So
going forward.
if the pets are mostly insulin dependent, does diet make a difference? Like if I have a
So
diabetic dog,
was
what kind of diet should I use as opposed to a diabetic cat?
sure, just like in people, carbohydrates are the enemy
Okay.
of diabetes, or you know, because they're metabolized into simple sugars, which is what we have we have trouble dealing with when you lack insulin. So most of the diets that we put these guys on are going to be somewhat lower carb. They're lower carb diets than the normal dry diets. We do encourage, particularly in cats, to use canned food.
Oh,
Okay,
the wet thing. So it's
exclusively.
a special diabetic.
Well, some of them are like, and we've learned a lot about that lately too. We
Oh,
do have
good.
very prescription diets that are, formulated
Mm-hmm.
specifically for diabetic cats. What we've learned is Fancy Feast, canned, the loaf, not the kibbles with
Okay.
gravy, but the loaf type Fancy Feast
Oh,
diets. We have successfully managed diabetics
wow.
That's
using that.
fabulous.
Isn't that cool? So,
Yes.
but the dry food junkies, these cats that you can't get off kibble, it makes it challenging, and you're better off using a
Yeah.
veterinary prescription
Mm-hmm.
dry food if you can't get your cat to eat a canned over the counter,
Okay.
food, because the dry ones that are veterinary prescription brands are going to be formulated to have, less carbohydrate, little more fiber, and fiber helps get stuff through the gut faster.
Mm-hmm.
So the diets tend to be a little lower carb, a little higher fiber. Dogs,
Yeah.
we don't have to do the canned food with dogs as much.
Okay,
Mostly
good.
with dogs.
They
Yeah,
eat.
mostly dogs. Yeah, because
They'll eat.
they're usually, but they are a little bit carbohydrate restricted. I always tell my clients to stay away from any kind of, well, treats are tough,
Mm.
Yeah.
but you don't want to use any, like, remember Kibbles and Bits, the food
Yeah.
that had like the crunchy and the chewy stuff. So
Remember
the
the one
chewy,
that was like a
or
hamburger
Gainsburger, yeah,
that you broke
Gainsburgers.
up?
Okay,
Remember
that's
that
like
one?
the worst. Those are like
Remember
the
that?
worst.
It looked like
Because
it had
that's
four
high in
cheeses.
sugar and salt, those soft,
Exactly.
pliable
They're
ones.
high in sugar.
Like a
Exactly. And so
sausage.
exactly. So any
Yes.
kind of chewy,
Yes.
soft food, thing. So for my
Ixnay.
diabetics, yeah, no.
You
So
know
for my
why those
diabetics
cats
with
like the
treats,
fancy feast? Because people serve it in that like Waterford
in the little
sugar bowl.
glass,
Yeah, but
the
it's got to
little,
be the loaf.
Right.
right.
It's
The
It has
loaf,
to
not
be
I
the
mean, it's
loaf.
like meatloaf to me.
Yeah.
It
It's
has
like
to
in
be
the
the
can,
loaf. It
it's
can't be
hard.
the kibbles with juice on them. So
Have you ever seen
anyway,
that
so
with that cat treat that you open up and it's like
churu,
liquid goo?
Oh,
churu,
true.
Oh,
Yeah.
they're the
That's
gross.
best.
when that's when you
They're the
can't get cats to eat. Like
Oh,
my
right.
Capri at the end with her renal failure. I bought all kind of flavors of
it
those.
was
Any
it's
kind of
gross.
people that made them, I bought them.
Oh,
Yeah,
But
they love it.
Linda, to
Yes.
address the soft and moist treats being high in salt and sugar, when we were driving the girls to Florida, the dogs,
oh, right.
Mike bought them. I've told this before. Mike bought these treats, and I use their food as treats. I don't go
Hmm.
the soft
You
and
use
moist
the
as
kibble
sausage.
as treats,
They don't even know a sausage exists.
right?
So I look at these treats on the table. I'm like, what is that? Well, the girls, they're going to be going there. They're going to be in the hotel. Okay. So we get to Florida, and Tawny is drinking and peeing like crazy. So
Hmm.
I take her to Dr. Ward, Heidi Ward, my internal
Hmm.
medicine friend in
Hmm.
Sarasota. We tested her for Addison's. We tested her everything, ultrasounds. It was the treats.
Wow,
She
that's
was
And I'm
crazy.
drinking like a
telling you,
fiend.
I thought, what, for 3 days, what's new? I
What was
started those
different?
treats. Yeah. So people really, these treats are not innocuous. I mean,
Mm-mm.
they're
No.
high in calories, and especially the pliable ones. Think of the sodium in there.
Yeah, they're pretty nasty. I tell people with treats with diabetics is, like you said, just use their food. But if you
Yeah.
have
Yeah.
a dog who's grown up with, always having something fun, I'll allow people to do like green beans.
Yeah.
Again, low and
Oh,
simple sugar. Like, people say, well, what about banana? Well, banana's a lot of sugar.
It
I
is.
mean,
It's
they're
high glycemic.
oh,
Yeah.
right. So it's benign from there's not fat, it's not going to make them
Right.
vomit, but and of course grapes are a complete no-no, because people
Mm.
sometimes want to use
no, no, no,
grapes
no,
because they
no.
they
That's
can
on
be
the
renal
bad list.
toxic,
Yeah.
kidney toxic too. Um, but the other things I did is low-fat string cheese,
Yes.
like
Oh,
so
yeah.
Mozzarella.
little teeny pieces of that. So not like,
Okay.
here, have a
Good
stick of,
to know.
just little tiny pieces, because it's high protein and low fat.
Yeah.
And, so that's fine for treats. But honestly, we probably ought to get away from,
Yeah.
the treat should be tons of praise, and,
Yeah.
anytime you're trying to do that. But to churros for cats, that's been a blessing. I mean, that's been,
True.
seriously, it's been really a good thing to
And you can get them at
have.
TJ Maxx, by the way.
Wait,
Gosh,
what can you get at TJ
The
Maxx?
churros,
the
those things in the
churros,
tube that,
the
Ugh,
nasty tube stuff that you were
gross.
saying
Yeah, I
about.
can't do that.
well, let's move
I
on
can't
to
even
Cushing's
open it
disease.
because it stinks.
I know.
They do stink, but cats like stinky
I
foods.
They
know.
like stink, Janet.
Okay,
The
so
Yes, they do.
we got to move on. We got to move on to
Okay.
Cushing's disease. So
Yes,
what
because
Okay.
I
is
know, Janet,
Cushing's
you don't know
disease?
anything about
I know
that.
nothing. I've heard it in
Really?
And
humans.
Liesl and I see it. That's kind of our departments.
Is that the one
Mm-hmm.
where humans get bulgy eyeballs?
No,
No,
that's thyroid.
That's thyroid.
Yeah, that
Okay.
has
we
to do with
might
that.
talk
That's
about that if we
okay.
have time.
Yeah,
Yeah.
if we have time.
So what is
Okay.
Cushing's disease? How do you know if your pet has it?
Okay, here's another, poly disease. The drinking more, urinating
Yep.
more is a big sign. Okay, let's preface this with cats very rarely get Cushing's disease.
Okay.
Oh, good
Like
to know.
it just like you'll have
Right.
like again twice in your career you might see it. It's just
Yeah.
throw that off the
One
list.
less thing for me
So
to worry about.
exactly.
Right.
So Cushing's, it's older pets. It tends to again be more. There are some breed predispositions towards it. We do tend to see it in like terriers, schnauzers,
Huh.
but any dog can have it. We do see it in large breed dogs. I've probably seen an overrepresentation of boxers, but we don't see as
And
many
a few
boxers nowadays.
Goldens too. I was
And some
surprised.
Goldens. Oh, we can see
No.
it in, yes, they're
Start
not
listening,
perfect.
Janet.
Yeah.
I am listening. I'm scared
So,
now.
so again, drinking a lot, urinating a lot. That's a huge sign. But then sometimes you'll have seen some subtle changes in the pet, like, your belly's looking a little pot-bellied. I'm not feeding you some beers. How come your belly's starting to hang a little closer to the ground, or gaining weight without necessarily feeding more calories?
We don't
And
fat
so
shame here, by the way.
I'm not fat shaming.
Okay.
I'm just saying it's
Just
not their
looking.
fault. Because
Just
what it
looking.
does, so again, so what Cushing's disease is, well, those are the signs of it that
Okay.
most people. Sometimes you also see like panting more often, or having more difficulty sort of settling down. We can sometimes, well, there's a lot of other stuff we can see with it,
'Cause
but
they
that's
don't
what
feel
people
well,
mostly
yeah.
bring
And
them in
people
for.
get this and have the same signs as dogs, by the way.
They
Oh,
pant.
really?
Yes.
They
There,
pant?
there was a news anchor, a woman who I read her story. I was doing something on Cushing's disease, and so I'm looking at all these Cushing's articles. She could not lose weight. She was a beautiful woman, and she was getting kind of like a moon face, and she
Oh,
was kind of big. And she said, and I was always hot, and I went to all these doctors. Oh, you're just fat. You need to lose weight. And she had Cushing. She had a tumor in her
wow.
pituitary. But anyway, go
Right.
ahead. Yeah.
No, so getting to what it is, it's a disease where the body is producing too much cortisol or steroid, and
Interesting.
cortisol like prednisone that we talked about with diabetes. So the body's producing too much of it. It's produced by a gland in your belly that's right next to the kidneys. So there's one on each side. It's called the adrenal gland, adrenal. So, and so Cushing's syndrome is when you have this urinating more, drinking more, blah, 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 your body's producing too much cortisol. The cortisol can either be it's made by the adrenals, but it either could be made by a tumor in the adrenal,
Oh.
like maybe just on one adrenal gland, or it could be that's operating independently of any feedback mechanism in the body. So it's there, it's just pumping out cortisol. Or it can be because of a tumor in the pituitary gland up in the brain
Right.
that is telling the adrenals to make steroid hormone. Now, when it's the pituitary thing telling the adrenals to make steroids, that's actually Cushing's disease. Okay, so
Okay.
it's kind of a semantic thing, but Cushing's. Most of our patients, 85% of our veterinary patients are pituitary dependent, where they have a teeny weeny little pituitary tumor that's acting independently and telling those adrenals to make cortisol. And then the cortisol is what is causing all the clinical signs, causing all the things that we're seeing. I got to drink more water. Actually what happens is it makes you pee more first, and then you got to drink to keep up. So that, and then it also causes changes, and this is where Alice, her specialty comes in. It causes changes in connective tissue. Connective tissue being skin, muscle. You'll get muscle wasting. They just can't build. You think of steroids causing bodybuilding kind of thing.
Wow.
But there's classes of steroids. That's the anabolic steroids that will cause gain of muscle. Corticosteroids, glucocorticoids, they cause, just yucky negative changes in skin and connective tissue. And this is where Alice gets her cases that get bounced over for this crazy thing called calcinosis cutis, where they get calcium in the skin. Blech.
And
But
we'll show
anyways,
some pictures of that too. Yeah.
oh, that's cool.
Yeah, I will.
So, so when we diagnose it, you take your pet into the vet. We kind of have a general idea. I always talk when I'm talking to the veterinarians that I talk to daily. I'll say, when you look at it, do you think it has an endocrine disease? Do you think it looks like it has Cushing's disease? So that's super high on the list. And that's what we talked about, the pot-bellied, in people. Alice mentioned this moon face thing. We don't really get that in veterinary medicine because, there's hair all over them and all that stuff. But definitely, pot-bellied, when you look at them from above, they don't have a waist anymore. So, and then we do routine lab work, just regular old, like that we ought to be doing on a yearly basis anyways. And that will show usually some characteristic changes. One of them being this very annoying enzyme called alkaline phosphatase that can be elevated for a lot of different things, but it is definitely up with most Cushing's patients. So that's like kind of the first step is the regular old blood work and a urine.
Yeah.
We always want to look at the urine too. But then there's some specialized testing that we do with respect to cortisol, where we actually give an itty bitty amount of steroid to the pet. And we want to see how does that pet respond to it. Does it shut down its own body's production of cortisol, or does the body say, hey, I'm going to continue to make more cortisol? And that's it's called a low dose dex suppression test, or sometimes we'll do another what's called the ACTH stim test. But they're basically looking to see, does the body quit making steroid when we tell it to quit making steroid. And so it's a very stepwise process. A lot of people then will do an abdominal ultrasound because there's a lot of, like most hospitals I would say have an ultrasound machine, or they'll have people come in that will do ultrasounds on pets for them. And we're going to look at those adrenals directly. Do they look plumpy? Do it look like we have a big tumor on one and a little shrinky, little raisin adrenal on the other side, or are they both kind of plumpy looking? And then that would support the diagnosis. So anyways, it's okay. From an endocrinology geek perspective, it's a fun disease for us. It's annoying as heck for owners. It's obviously annoying for the pet themselves. So,
and then I assume the pet goes on some kind of medication.
Yeah. So we put them on a medication that just decreases the production of cortisol is probably the easiest way to put it. That's come a long way. Back when Alice and I were in school, the drug that we used basically destroyed the adrenal gland, and I actually kind of liked it because it was almost easier to. Anyways, but that drug doesn't exist
anymore. By the way,
well, you can get lysogen. It's compounded only.
Yeah.
The humans don't use it at all anymore. But now we have a drug called trilostane, and that drug it kind of halts the production. It aborts in the middle of a pathway the creation of corticosteroids or glucocorticoids, and it works very well. It's expensive. I think that's the biggest drawback to it is it's an expensive medication. There's no legal generic of it, so hopefully in time, it's been out long enough. I think that it's got to be coming. I know. I should look into that. Why we don't have a generic of it yet? Because it will definitely be picked up by somebody.
I would think
from a generic perspective. So but it works really well.
The pet then leads a pretty normal life once they're regulated.
Yeah, it can lead a great life. And the whole point of Cushing's is that when we treat it, we treat to increase quality of life of the pet and of the owner. Okay. Right. Even when we treat it, we don't necessarily prolong their life. We just make their life way better.
Yeah.
And so there are some dogs where, if there's lots of different stuff going on with them, or the owners can't afford trilostane or the drug to treat it, but they can deal with getting up in the middle of the night to let the dog go potty outside, or they're home during the day, they can let it out. A lot of times we won't treat, and we won't treat because, they can't afford it, and it's not a disease worth euthanizing over if it exists, unless there's just the quality of life is so bad, that we can't do anything about it. So it's definitely, one where sometimes we'll diagnose it, and if the pet, so this frequently happens. People will call, talk to me to do a consult, and they'll be like, this dog has this high alk phos. It's got this high alk phos, but the owners are saying it's not drinking a lot. It's not really urinating a lot. I think it has Cushing's disease. And then they'll go on and test for it and say, I should treat this dog, right? I'm like, Well, if the owner doesn't see, things that
Right.
that can be fixed outwardly, then maybe we won't. We won't treat, and we'll treat maybe down the road if in 6 months or a year, or as the case may be, when they present to Alice for nasty
Yeah.
skin.
They lose all their hair and they get a rat tail. They keep their
Oh,
hair on their head, but they lose their trunk hair and their rat tail. But Liesl, I love the saying, just because we can do something doesn't mean you should.
We should.
right.
And when that liver enzyme is elevated, and okay, so then maybe you'll do an ultrasound. Yeah, he has Cushing's. If they're doing great, I don't do anything. I mean, because there's a lot of monitoring once you put them on Trilostane, and there's people that can't afford that monitoring, sadly. But did you ever have any surgical cases, like where they had the adrenal tumor? You don't see too much of that,
We
do
don't
you?
see them too much. So if we have adrenal tumors, it does tend to be the large breed dogs more
Yes.
than the
Oh,
small breed
interesting.
dogs. So if we do the numbers of 85% of them are pituitary dependent, 15% of them are adrenal dependent, in that 15 that are adrenal tumors, the vast majority, like I would say 90% of them, are large breed dogs. Have we? I definitely sent some to surgery. They can have be surgically resected, and when we tend to send to surgery, and if hope I'm not talking too fast, I tend to get louder the longer I
No,
go on, but
no, you're
that's
fine.
not too bad. Okay, but when we send them to surgery, the things that we look at before sending them is probably what I should say, is on ultrasound, do we have any invasion of? Okay, so the kidneys, the adrenals are right next to the kidneys, and then they're right next to these very big blood vessels called the vena cava and the aorta. But what can happen is that tumor can actually grow and invade the vena cava.
And wrap around it.
Oh yeah, and it's like, and if it's like that, then surgery.
Yeah.
We usually won't even attempt it. But if it looks like it's not invading any big vessels with short names,
Right.
then we can go in and with a very good surgeon, cut that out, and the dogs can go on and live great lives with nothing. And then all that stuff gets better. The drinking, the
Yeah,
urinating, their skin improves, the hair coat grows back. It takes like 6 months to a year once we have, get rid of that extra cortisol, but it's a good disease. Well, it's not a good disease. No disease is good.
No, that's true.
But at least it's diagnosable and treatable.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
I just watched a really good webinar on Cushing's. I can't remember who sponsored it, but
The human side or the veterinary side?
veterinary. And apparently there's 2 vet schools in the country that take out pituitary tumors. That they go through the
Oh.
roof of their mouth.
Oh,
And they do that in humans. In humans,
Probably
it's
Auburn. I think
surgical in
Auburn.
humans. Yeah,
Yeah.
might
I
be
think Auburn.
Colorado, but I don't
Colorado.
remember.
I mean, Mike
Yeah.
did get my husband's a boarded surgeon, and at the Animal Medical Center they would do it too. That's the
Okay, in
freestanding
New York
one
City.
in New York. I don't know. That was a long time ago. I don't know if they're still
Yeah.
doing it now, but
That's
yeah,
gotta
they
be rough.
for
Because that's gotta be teeny tiny.
well, and the problem is that the way that the anatomy of a human is different than the anatomy of our dogs, and
You
so
mean the
it's a harder.
skull?
So it's
Yeah.
harder to get to the place. In people, it is pretty simple. It's right above the roof of the mouth.
Yeah.
Dogs, it's a it's quite a bit harder. So we actually had somebody here locally that did do it, but he left, and
Okay.
I don't know where he went to, but he was trained at Auburn. So
He got
there
run
you
out of
go.
town. I'm just kidding.
I have no idea. I am not in on the local poop
Yeah,
anymore. So to
Liesl and I,
speak.
we just mind our own business.
Right. You just do your own thing. Exactly.
Okay,
So,
Now let's, oh, go ahead,
We have
Jan.
one more disease we wanted to talk about.
Thyroid.
Thyroid disease.
Again, Liesl and I are both involved with that. Go ahead, you start, Liesl.
Thankfully,
Let's
I'm
do dogs
not.
first.
so I want to do the hyper side. I want to do
Yeah,
the,
okay,
the
let's
too
do
much
cats
thyroid
first.
type. Yeah, let's
Okay.
do cats because so hyperthyroidism, hyper lots,
Right.
thyroid glands. So the thyroid glands sit right in here in the neck. They help control metabolic rate in the body through a hormone called thyroxine. When we measure thyroxine, it's T4. It's called T4. So on blood work, if you get your blood work done at the vets and it says T4, that's what that means. They're testing thyroid function. In kitties, we tend to see hyperthyroidism, and it's caused by we'll call it a tumor because it is a tumor, but it's a little area of abnormal cells within the thyroid gland that operate independently and produce too much thyroid hormone. Normally, the body's a whole bunch of different feedback, mechanisms. Something tells something to turn on, and something tells something to turn off. But with thyroid, just like with Cushing's, but with thyroid disease, these are acting independently of the body's turn off mechanism. So kitties, we see the majority of them are hyperthyroid. It's a fairly simple diagnosis in that we do blood work. We see if that number's high. Now, the caveat too is the number high. Once a cat is over the age of 10, okay, the thyroid, where we start to get a lot more interested in that above normal is kind of the mid-range of the normal range for thyroid. So I'm not trying to confuse people, but there will be cats whose thyroid will fall into the normal on a piece of paper, the normal range. But if they're over 10 years of age and they're sneaking up still within that normal range, we usually will recommend doing a little bit more testing, a more specialized test called a free T4, especially if the cat has any weight loss for any reason. If they're and I should have said this too, clinical signs of the disease, sometimes eating out of house and home, like crazy eating in a cat that normally was like a couch potato. And suddenly it's like interested in eating all the time and losing weight. Okay. That's the vast majority of cats. Some of the cats won't have such crazy clinical signs. Some of them will lose weight or you'll come into the vet office and the owners won't say that they're eating a ton, but their heart rate will be crazy high, and maybe they've had some weight loss. And so there's definitely, again, a spectrum of disease, but the poster child would be a cat that used to be normal, slept 85% of the day, now comes in, is a lot more active, eating more, maybe drinking more, losing weight despite all that. Sometimes we'll see diarrhea, sometimes we'll see vomiting because
It's like
they're eating
everything is speeded up.
everything. The whole metabolic rate is like,
Okay.
And that doesn't happen with humans. You can't eat and lose weight. Just doesn't happen.
I don't know. I don't know enough about it in people.
I'm just saying, it doesn't work for me. But anyway.
Well, maybe we'll start taking some thyroid medication. I don't know. I don't. The people side of thyroid is crazy because it is markedly different than the way that we it's markedly different than how we manage stuff. So treatment, diagnosis is pretty.
Older cats.
And they're usually old cats. I think the youngest that I've ever seen was 4, which was
my gosh, really? That is young.
It was very young, and so
What's wrong with that cat?
Well, right, and there's always that question of too that is the cat that you got from the shelter truly the age that you're telling you it is?
Don't know.
And so so if it was 4, I don't know that one we actually knew exactly, but that's what was in the records. I had to go with it. Okay, so treatment. There's several different, there's 2 main ways. The probably the best way in all reality is to get what's called radioactive iodine therapy or I-131. Really simple treatment. What we do is we inject the kitty with an under the skin injection of this radioactive iodine. And why we use that drug is because iodine is part of the thyroxine, molecule itself. So when we give that radioactive stuff, what happens is, goes boom, and gets picked up and gets put in the thyroid gland. But because it's radioactive, it will kill the cell that picked it up, and then 1 or 2 cells adjacent to it. So the cells that are most rapidly crazily making, thyroid hormone
Yeah.
are the ones that get killed, and then a little bit adjacent to it. Now the nice thing is when those cells were going crazy, by themselves, the rest of the thyroid's not doing anything. It's just like, whatever. That one's doing all the work.
Oh,
I don't have to do
wow.
anything. So when you when you kill the crazy cells with the radioactive iodine, a few days later, those other cells go, wait a minute, where's all that thyroid that we were just swimming in? And it will start to, come back and make thyroid. So you don't make them, the vast majority of the time, we're not making them the opposite direction. We're not making them
They don't bottom out.
hypothyroid.
Right.
Yeah, they don't.
Yeah.
But
Sometimes,
can you be
but most
around
of them
that
do come in.
pet?
Oh.
So what we do is we
question,
usually,
Kim.
yeah, it's a great question. We usually keep them in the hospital for 3 or 4 days until they've had, the reason is so that the majority of the urine and feces that would have some of
Right.
the cleared radioactivity in it, and then we have to keep that stuff for like 3 months, and then before, and we have to Geiger check it all the time. I mean, it's kind of it's a lot. But then when they go home, we do recommend that they stay a minimum of 6 feet from the owners for 2 weeks. And so that usually means like in their own bedroom, sadly, or, a room where they're not going to be like laying all over you. Because the last thing you want to do is have, the cat laying across your, thing,
right, with its
and having
I-131.
with its I-131 right across your neck. It's probably, the recommendations are probably overkill, but I mean,
Yeah.
you do
Yeah, but-
absolutely need to listen to them, particularly with little kids and stuff,
Wow.
or like really old people. So, but it's really cool. It works great. Usually one injection, it's curative. You can have, it's a very small percentage, maybe like 5% might have to have a second injection down the road. But is that because the first one didn't work, or is it because they decided to make more cells be stupid, or like
Yeah.
the thyroid gland decided to get a little nutty again, which I think that's probably what happens more so than the drug not working the first time. So that's one thing. That's the best way if you can afford it. That's the way I would go all the way, especially in a cat who doesn't have other diseases. Now, the other way that we treat them is with a drug called methimazole. And what methimazole does is it blocks the thyroid from being able to pull iodine into it. So in essence, decreasing the body's ability to make that thyroxine. It has to be given daily, usually twice a day. So sometimes usually twice a day. We'll just leave it at that. Now, methimazole works well. It can be given orally. It can be made into chewable tablets. It can be also given so that it's put on the ear in what we call transdermal dosing. It's one of the kind of reliable drugs that we can give on the skin that will then get absorbed through the skin and still be able to do its job. There's not a lot of those that are effective at at doing that, but we can use methimazole. It works great. That using the oral drug is great when you don't have a chunk of change to spend on I-131 because it's well over $1,000 now. I haven't priced it lately, but it's a lot of money. And methimazole, it's little bits of money, because it's an oral drug and it's not a real expensive one. I tend to use that also if I have cats that have concomitant diseases. So kidney disease. If we have kidney disease in a cat, I'm really reluctant to send them for I-131 because that crazy hyper state from hyperthyroidism actually delivers more blood flow to the kidneys. And what are the kidneys like? They like blood. The kidneys like blood flow. And so when you pull back by treating the hyperthyroid state and pulling back that excessive renal blood flow, it can what we call unmask underlying kidney disease. And so many old kitties have kidney disease. And so it ends up being this balance of a little bit of methimazole to keep the thyroid, controlled and watch those kidneys. Are you doing okay? Do we need to back off or, can we give a little bit more? So this is where the art of medicine comes in, where you have to balance not killing one organ system, to fix another one. So it's fun.
Now, what about
again, in a geeky endocrine way.
There you go.
love a good endocrine story, right?
Yes.
What about now in dogs?
Okay.
Thyroid.
Alice, you need to. I hate hypothyroidism. I truly do. And
Oh,
I
that's
hate
in
it. I
dogs.
hate it.
And I love it because it
I, d-
explains so much.
I know. I think the hardest thing with thyroid in my world is that, again, we check this T4 on normal blood work,
Yeah.
and thyroid can be there's a lot of things that influence thyroid production in the body. And there's also this thing that's called sick thyroid syndrome, where we can have thyroid that on paper measures low, but that pet is not hypothyroid. That pet does not have low thyroid. And there's so many times when people will call because the thyroid was low, and they're like, oh, the dog's hypothyroid, I need to treat it. And I'm like, wait, let's back up. Do you
Yeah.
think the dog has thyroid disease? Like,
Yeah.
again, that question of, do you think the dog looks endocrine? And by endocrine, sometimes they look similar to the Cushing's dogs in that their hair quality is yucky. They can have, skin changes, poor hair coat. And this is because the hair just doesn't undergo, and Alice can talk way more in depth about this, but the hair doesn't go through its normal cyclic process. Fur doesn't go through its normal cyclic process.
That's okay. I
right?
call it hair.
Yeah, anyways, fur. And so, we can also see dogs that they tend to be obese. They tend to be kind of meh, like, I don't really want to do anything. But how many like Labradors come in that are just obese couch potatoes because they're fed too much food?
Yeah.
Right.
Well, and they're eaters. Labs are eaters.
Right. They
Yeah,
have
but
like a neuron that goes from here to here that just says, feed me,
Anything.
But there's and having said that, there's a lot of I'm petting two golden retrievers at once. There's a lot of dogs on thyroid medicine that really have no reason to be on thyroid medicine,
Exactly.
and that's I think bothers both Dr. Bigge and myself. But I will say, when I adopted Cinnamon was a golden retriever, 110 pounds, and they gave her up because she was limping. She was profoundly low thyroid. I had her till 15 and a half, and she was 55 pounds once we corrected her thyroid.
She
She
was a
was
big girl.
limping because she was so fat and probably had some joint issues from being hypothyroid. So, yeah.
Yeah.
She truly was hypothyroid, but there are dogs out there that are on thyroid meds that have no reason to be on thyroid meds.
Yeah, and they'd be better served by, using food as a drug, meaning
Yep.
either a prescription diet, low-fat diet, or working with your veterinarian or a potentially veterinary nutritionist to come up with a food that's the correct caloric intake, but gives them enough satiety that they're satisfied by the food, but it does restrict calories and gets that weight off of them. But that's why I hate dogs with hypothyroidism. I don't hate the dogs. I hate
Condition.
I hate the situation, because it. And then the other thing is that, and this drives me nuts, and I'm just complaining to the universe here, but on a lot of times the lab work that labs will run, the panel will have a thyroid on it for a young pet. Now, hypothyroidism is an old dog disease, and hyperthyroidism is an old cat disease. Youngsters, if you do a panel of blood just to see, okay, what's my dog's normal blood work, so I know what their normal is when they're a youngster, and their thyroid will be a baseline, right? And their thyroid will be above the normal range, and people will call and like, oh my God, is the dog hyperthyroid? I'm like, no, those normals for thyroid are for old dogs. They're not for young dogs. So, every once in a blue moon, we'll have a dog that actually is hyperthyroid, an old dog with hyperthyroidism, but it's usually because they have a really bad, like they have a tumor that is a bad tumor that's producing excess thyroxine, and that's a whole nother story, but it's that's less common. So
Well, I'll tell you, as a pet owner, I'm really seeing the importance of the blood work.
absolutely.
And you can identify, tell me if I'm wrong, you can identify any of these issues.
But I will say this, as a person that gets a crazy person, that now I have young dogs, but I've always had old dogs that I've adopted because no one wants old dogs. I did blood work on them every 4 months and ultrasounds at least twice a year. You can have totally normal blood work and the dog has cancer.
Yeah.
Seriously. I mean, Cinnamon, the one that weighed 110 and ended up being 55 pounds because she was hypothyroid, had 5 different types of cancers, and her blood work till the day she died was totally normal. So, I mean, it's still a good thing to do. She had 2 sarcomas, intestinal adenocarcinoma, thyroid cancer, which I kept aspirating, and finally Dr. Thaloffer said, quit sucking those cells out.
Right.
But anyway, yeah, so it's a good idea to have your dog's blood work done, but
Right.
with the caveat that normal blood work doesn't mean they don't have cancer. It diagnoses a
Correct.
ton of other things.
But humans too.
And it's all we
You
can
know, your
do.
cholesterol
You're right.
can look really great,
Absolutely.
but who knows?
Right.
Right.
Right. That's
Wow.
true.
This
Yeah.
has been really,
Absolutely.
really interesting. I think what I've learned is those annual checkups are super important, and you have to pay attention
Yeah.
to changes in your pet, like changes in your human.
Changes mean everything because they really are creatures of habit. And when they start to do something that's not in their wheelhouse, you kind of need to go, wait a minute.
Yeah.
She doesn't do that. She doesn't go sit in a corner like that. What's going on?
Or like
Yeah.
Shaggy would all of a sudden he'd be going to get up, and he had Lyme.
Oh, that's right.
Oh,
'Cause
that's
she's
right.
genetic
That's
Lyme.
right.
Yeah.
We
My
had
son's
this.
had it 3 times. I've had it once. So like, we're like this Lyme center. But that was
Yeah.
the big change. I'm like, I'm watching. I'm like, what is wrong with you?
Yeah.
You know?
It's important, and videos. You know, these things that people have in their hands all the
Yeah.
time, right?
Oh,
I
perfect.
I am I'm all I tell people all the time, please, you know, can you just video what your pet's doing? Because if
Yes.
you know they come into the office and they're excited to be there. It's a
Yeah.
different environment,
They're
and
off.
you know,
Yeah.
and you know, epinephrine can, you know, override a lot of things, but this helps a lot too. And the other thing too, I have people, can you pull up an old pet of your pet when it was like 2 or 3?
Oh.
And then we'll say, oh, look, you see how this, you know,
Oh,
this
that's
look
smart.
wasn't
Good
there.
idea.
And then we, you know, we usually take a baseline picture before we start treatment. Then this is going to like Cushing's disease in particular. We'll take a base, or thyroid, this would work too. But I hate thyroid. I'm going to send them all to Alice. But anyways, so we do
And
a
I
Little
love it.
bumper sticker. I hate thyroid.
baseline picture. And then we just, every, you know, 3 months or so, we'll take pictures, and it keeps people like, oh, wow, look at that. And the weight checks and, you know, follow-up labs and stuff. So
But the video,
I need-
the video I missed though the other day is I'm looking
Yeah.
out the back window, and we have this old birdhouse with a hole in it. I sent Alice a picture,
Yeah,
and
you
I
did.
look, and the male cat has one paw on top, and it's got that paw in that hole going like
There
this.
better not have been babies in there.
We don't know. I don't know if
Okay.
anybody
Yeah,
listened.
kitty.
It's been up in the rocks forever, and I'm literally like, I was laughing so hard because he just kept going in there, and then he'd stop, and then he'd go because he must have heard.
oh, there were
something.
totally babies in there.
Yeah.
Are you kidding?
Had to be.
I don't know.
I have to tell you a very important thyroid story. Now that you can get prescriptions, dog prescriptions at human pharmacies, okay?
Right.
And when you treat a dog for low thyroid, they're on a higher dose of thyroid than we are as
Over
humans.
Yep.
So after I retired, I had a pet parent email me with, it was like a little white poodle Maltese type dog. And it was on thyroid. It was on 0.1 milligrams. It was a 20-pound dog. So it was
Okay.
actually low for that dog. It was on 0.1
Low, yeah.
milligrams a day. She texted me and she said, I'm so worried. My dog, who is perfectly fine, now has a murmur and she's panting all the time.
God.
Everything. Well, they gave her 1 milligram of
milligram?
thyroid. And and thank God when she went to the vet said, bring me the medication she's on. He looked at the vial and it said 1.0 instead of 0.1. And they had all this cardiology workup and
difference.
everything else. And yeah. So be very, very careful. Liesl, I think you would agree, a lot of times we have pharmacists calling to confirm the thyroid dose. Because here's a 50-pound golden right here. She would be on 0.5
0.5.
milligrams twice a day, or maybe once a day.
Maybe
I
once a
always
day,
start
yeah.
them low. I never do the
Yeah.
textbook dose. But that would be very high for us. We're on 0.025 milligrams
Wow.
a day. So I would rather a pharmacist call us to confirm than to dispense something thinking, well, that doesn't sound right. Maybe it does sound right. Maybe we have a reason for that, is what I'm
Hey,
trying to say.
I went to CVS once, and they tried to give me the drug for my father-in-law because my husband has the same name, and I'm like,
Oh, okay.
that
Wow.
was, and I don't like to go to that store for that reason now.
Yeah.
Gotcha. There's
In their
there's
defense, they're filling 500,000
I
to
know.
1,000 scripts a day. And I get it. As a former pharmacist, I can tell you. But still, if there's ever a question, it's better to call the doctor or the veterinarian than to give the wrong medication.
Well, and I have to say, every time I had to shoot the cat, I was so careful. I'd check that bottle because it was in the fridge. Okay,
Yes.
it's 0.2. Okay, I'd make, I always double check because I was so
Good,
afraid.
Janet.
No, I
Good.
didn't want to
Yay.
overdose or underdose. It was
Yes.
stressful if you're not a medical person.
Right,
Yep.
right.
I didn't want to screw
It
up.
is.
Liesl,
It is
before
the
we go,
pets.
what pets do you have right now?
So I have Rue, come here. You want to come? Rue,
Come here.
come here. She's not going to get up. Come here. You want to come over here? She's
I
not going
love
to come
her
over here.
chair, Janet.
So
It's an
I
Ohio
know, I
State
love the
chair.
chair.
yeah, you love that. I know it's getting the seat of it's getting a little raunchy though. So I either have to figure out how to
Duct tape.
recover it. Yeah, I think that's probably.
The
But then it
seat's
gets
the first to
gooey.
go.
Or get
I
know.
like a fuzzy pad.
Well, right now I have my Ohio State blanket that I'm sitting on because it's nasty.
We can
It's
get
just
you a
ew.
stadium seat.
Oh, I have lots of those in the garage.
you
But
go.
anyway,
Hey,
so I
don't
so I
forget-
have.
Go ahead.
ahead.
Oh, don't
No, I
forget
have-
to order Rusty's book.
Oh, it's Rustin. Don't you know? It's
I
Rustin.
know. Well, it's Rusty to us, but
He's
yes,
really
and he's
know.
going to be on
Rustin?
in 2 weeks talking about the
Rustin.
book. It's very
Oh,
good.
there you go.
By the
All right,
way,
cool.
I looked it up while we were talking. There are 63 days until the Ohio State Buckeyes football season opener against the Texas
Against Texas.
Longhorns
And
on
I got
August
tickets.
30th.
Whoop whoop! I got tickets.
You got
I
tickets.
You going?
She
Yeah.
does. She's
I
always
do.
got tickets.
Oh
Yeah,
my
well,
God!
not always,
and it's
but
going to be
we
on
definitely have-
Fox.
Where do you
I know.
park? Can I ask you?
I do. I park right. Well, now I park because I have a senior in mechanical
Oh,
engineering that's there.
lucky.
So what we did is he has a parking pass for his apartment, but because he lives, right off campus, he can get street parking
Oh,
Yeah.
there you go.
also. So we buy the City of Columbus pass, and then he normally parks behind the house, but for football games, he goes and parks in the street so that I can park in the garage,
Love
or not
that.
the garage, but park behind his house. And then my youngest is starting there in the fall, and so.
Oh, I love it.
Studying
So
Four
I will
more
have-
years of good parking.
Exactly.
Studying what?
Chemical engineering.
Oh, that's my
So-
son is a chemical engineer. So you have an ME and a chemical engineer. That's awesome.
And then the oldest is a data analyst, and he lives in Texas, and so he and his girlfriend are coming up for the Texas
Oh,
game
I
also.
love it.
So,
my
So-
the one that's going into chemical engineering, I have to send you, there's a book that gets you through organic chem.
Really? Okay.
And I'll
Well,
look
you've
up the
probably
name
already
of
been
it,
through
and
that,
it's
no?
my,
Oh, not
a friend of mine who was an engineer said, you have to send this to your son. And Henry got the book at Georgia Tech and went, whoever told you to get that book, please thank them for me.
I
Okay,
hated
good.
organic chemistry, didn't
Everybody
you? Liesl?
does, but there's this
I-
book that is,
Yeah, I think did I hate it? I think I knew that it was going to be horrible, and so
You
I was
dreaded it. Yeah.
I was really crazy about it. Like I taped all the lectures with
Yes.
my little tape recorder, and then I go
Yeah.
back and listen to them another time.
Yeah.
Now it's such a different way of learning because these kids, they tape all the classes. I mean, they're like either
Yeah.
Zoomed or it's so
okay,
different.
it's called Organic Chemistry
Uh-huh.
as a Second Language. And let me tell you,
Oh,
I read it
cool.
the first chapter, and I understood it, and I
Cool.
am not a chemistry, like a science person.
okay.
But it's what
Organic
got him
chemistry.
through organic, and he had a whole year of it at Georgia Tech. So
Right.
Yeah.
he was
Georgia
like-
Tech's a great engineering school, like
Yeah, he
one of the
loved
best in the
it.
country.
he loved
It's-
it.
it's
I'm not so
really
crazy
good.
about Atlanta, but he loved it.
Yeah.
Yeah,
Right.
hot
4
right
years there,
Atlanta.
yeah. Yeah.
Oh,
sit.
look how cute.
Oh, hello. Hi,
Camera
Judy.
shy. Oh,
She a good girl. That's
what a
real.
cute.
He's my baby. That's my baby.
These two think I'm talking to them. Oh, what a cutie. How
This one
old?
can't come in here because
She's 8.5.
8.5. She looks good.
Yeah, she's good. She just tried to kill herself 2 weeks ago though, because Corinne's graduation party was 2 Saturdays ago.
Yeah.
The Saturday before ACVIM, and so people were being helpful,
Yeah.
and they brought all of the desserts in from the back porch
Yeah.
and left them on the center counter.
Brownies.
And it wasn't just it was like it was ricotta cake. It was there wasn't a lot of chocolate. The chocolate wasn't the bad thing, but ricotta cake, these like complete butter things that my mom made.
No.
Like Alice, what's the highest triglyceride you've ever seen?
Oh gosh. In dermatology, maybe 1900. It's
5,000.
oh my God.
Yes,
She
5,000.
must have had horrible pancreatitis.
Horrible, horrible. So, and this is, of course, I'm leaving to go to Louisville the following Tuesday.
Right.
Now, so this happened Saturday night. She's puking on Sunday. I'm like, whatever, serves you right. You just got into this stuff, you know. And I knew the chocolate part wasn't a big deal. I'm like, okay, you'll get better.
Oh my God.
Well, Monday she was still drinking. She was down on her appetite a little bit, and I'm like, okay, whatever. I leave on Tuesday to go to the meeting, and I had a whole treatment sheet. In fact, it's probably still here. Whatever. I had this whole treatment sheet for the dogs. Oh, it's hilarious, actually. You can appreciate this as the anal. Here's my treatment sheet for the dog. There's all the
I love how it's
medications, the
handwritten.
times.
Yes,
Oh yeah.
I love it.
Exactly. So I have all this, and I said, and then the last column is, Serenia, right? That's the biggest drug, right? I'm like, only call me, and we'll decide if she needs to get it. Well, she puked one more time, so I said, okay, go ahead and give the Serenia, and then she puked the Serenia up. I'm like,
oh boy,
you're in. So she
Where'd
went
you
down to
take her?
She went down to MedVet. It was 24 hours in the hospital. This is with a veterinary discount. It would have been $4,400.
Whoa! And how long was she in the hospital?
24 hours.
Oh my God.
It's expensive.
It's crazy.
Hey, Liesl, thank you so much.
This has been so
bet.
great. You explain things so well. And I'm using the word simple because I understood it.
Yeah.
Okay. Sometimes I think I
Your
overtalk.
work here is done if she got it.
Yeah, if
And
I
she
got it. Yeah.
Woohoo!
All right. Well, listen, this is Dr. Alice Novotny-Droman from Cleveland, Ohio, and
Janet Novotny King from Cleveland, Ohio, the Novotny sisters saying thank you for listening. We appreciate you. Don't forget to love us, like us, share us. And we're going to take a quick picture and say see you next time, folks. Thanks for listening.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA Video Production.